time now to turn the focus away from the budget for just a little bit then and turn it to earnings. Take a look at earnings coming in from Max Healthcare and connect with the management then. We have Abhay Soi, who's the chairman and MD at the company, joining us. Abhay, first of all, good morning. Thank you so much for taking time out and joining us. I wanted to ask you about your overall growth at this point because that seems to be good. But you do have the RPOB as well as the occupancy levels that have gone down. You already stated that they were going to be going down, but what could the trend then look like going ahead, given that you have already done several acquisitions recently?
So there are two aspects to it. One is, on a quarter-to-quarter level, they are always, the third quarter is a weak quarter because of holidays during Diwali and New Year's and Christmas. But you also have to keep in mind that we've had a new hospital, which is Dwarka, which is functioning. And we also had a new acquisition, which is JP, which was done in October. The newer hospitals will have a little lower occupancy. Let me tell you, on a quarter-on-quarter basis, and that's what brings the average, sort of pulls the average occupancy down by just a shade. But having said that, let me also sort of highlight that all existing hospitals, there's been a year-on-year growth in occupancy. I mean, last year, same time, it was 72%. It is about 77, 78% this year.
Right. This is Cheryl also joining on the other side. I wanted to understand, other than Dwarka, what about your Lucknow and Nagpur hospitals also? What is the progress on the bed additions at those locations, as well as if you could talk about Mumbai as well?
So, look, I'm very glad you asked that question because literally all three formats of inorganic growth, which are acquisitions, which is brownfield projects as well as greenfields, we seem to have demonstrated operational excellence. We have broken even in Dwarka in record time of 6 months. We started the hospital towards the end of July, and by December, we've already broken even. Although the losses of November and October pulled the quarterly EBITDA for that hospital in Dwarka down. So it was down by 5 crores, minus 5 crores. But in the month of December itself, we've broken even, and we believe this is a sustainable break even. And going forward, it is only going to further ramp up towards positivity. Having said that, if you look at the two acquisitions, and literally we made these acquisitions 9 months ago of Nagpur as well as of Lucknow, we have more than 2x the EBITDA in both these hospitals in a space of 9 months. And just if I look at the quarter, there's been a 91% increase in Lucknow in the Q-on-Q EBITDA, and there's a 54% increase in Nagpur on a year-on-year EBITDA for both Lucknow and Nagpur.
All right, so I wanted to also talk about the robotic surgeries because you've got a number of insurance providers now also covering robotic surgeries. Patients seem to be also opting for such surgeries given the likelihood of faster recovery. So given all of that and against this backdrop, then how much are you seeing the impact then when it comes to the average length of stay and even the average revenue per patient then?
So it is an increase on RPOB. It is a reduction in ALOS, but we have 28 Da Vinci's, 28 robotic systems in our facilities. So pretty much every hospital of ours has that. And like you rightly pointed out, most patients, because the stay is lower, the less complications, the invasiveness is less, prefer these sort of procedures, robotic procedures over conventional ways of doing surgeries now. And having said that, RPOBs are higher, but the margins are lower, essentially, on this in percentage terms. In value terms, it is more. So you'll see a ramp up in EBITDA per bed as you sort of move towards, more and more of these surgeries. But you will see a reduction or a push towards a reduction in margins because percentage terms, they offer lesser margins.
So, sorry, I just wanted to understand, how has the payer mix been in this quarter?
Well, there's been a little increase in institutional, and that's largely due to the new acquisitions and the new hospital that we set up. Because in a new hospital, when you set it up, you typically focus on occupancy, and the distillation of payer mix happens subsequently. And similarly, that's in the greenfield as far as Dwarka is concerned. Similarly, if you look at some of the brownfields, some of the acquisitions that we've done, prior to the acquisition were operating at lower occupancies, now are operating at higher occupancies. It's because we increase occupancies by taking all sorts of this thing, but it has a good impact on EBITDA. because all of those institutional patients also contribute towards fixed costs.
All right, then, Mr. Soi, also talk to us about your margins then, because there's been a slight contraction on that front as well. So how are you seeing the guidance then evolve when it comes to the margins and even the growth roadmap that you're then penciling in?
I'm not going to give you a guidance, but what I can tell you is, we've had a robust growth this quarter. It's 35% on top line, 32% on EBITDA. Over the next 6 months to 1 year, I think we'll be entering a glory period for us because literally in the months of April, May and June, you're going to see 3 new brownfields come up, at our existing Saket facility at Mumbai, Nanavati, as well as Mohali, Punjab. And then in December, we are going to have Gurgaon opening. So I think all of these on schedule, and these new capacities should help us boost both our top line and bottom line significantly.
Right. Mr. Soi, there have been some reports that have been talking about how aggressive growth plans actually can have impact on return ratios. I wanted to ask you, what's your view on this? How would you defend this sort of statements coming out?
Well, coming to your first point, I think, this has been our 17th consecutive quarter year-on-year growth as far as top line and EBITDA is concerned. All the naysayers about having impact on EBITDA margins and EBITDA, we've yet to see it over the last 17 quarters. And I think we've quite rightfully demonstrated that there has not been any impact on margins. You've seen it in our greenfield venture. Typically, it takes anything between 1.5 to 2 years to break even. We broke even in less than 6 months. In a brownfield, we've demonstrated very high, if not full occupancy within 30 to 60 days of launching it. In acquisitions, we've shown you more than 2x, change in EBITDA since acquisition. We are very well on line to achieve our 20 to 25% ROC levels within 3 to 4 years. I think, I don't see dilution of margins, coming forth in quarters to come.
Well, before we let you go, I've got to ask you, what are your expectations then when it comes to the union budget? What makes it to your budget wish list then?
First and foremost, that the government expenditure towards the health sector outlay should increase as a higher percentage of GDP. I think it's quite negligible compared to other parts of the world. Even if I was to look at other developing economies where they are concerned. Secondly, the private sector should be encouraged further to set up, to do more capital expenditure. In any case, we are reinvesting all our profits towards significant capital expenditure to create more assets. I think what will be helpful is reconsideration of rates as far as institutional payers are concerned, such as CGHS and also Ayushman Bharat. So we truly achieve, our slogan of healthcare for all, quality healthcare for all. I think what will also go a long way in achieving that is perhaps reduction in import duties of certain critical equipment, if that was to be possible. I think another matter is perhaps GST. I think GST needs to be relooked, the GST structure for the healthcare sector, but that's perhaps a conversation for another forum and not for the budget itself.
All right, Mr. Soi, thank you so much for joining us on ET Now to talk about Max Healthcare's earnings in the quarter gone by and what are you penciling in going ahead. All the best for that. Thank you so much for being a part of the show.
If you like this video, then like, share and subscribe to ET Now.